Tidewater Arts Outreach's core components are training, advocacy, and outreach. And this training exemplifies, I think, how we're best at pulling together people in the community to form collaborations that bring different things together to benefit a population in a new way. Not enough people know about dance with elders and what the benefits are. We're working very hard to promote the use of arts with elders, and we need to turn that light on. We can't hide it under a bushel. Part of the needs that we've uncovered and that we want to help address are the needs for the community to be more supportive and aware of the hard work that staff do and caregivers, the challenges that they face, and how can the community help. And so we're engaging the creative community to use their creative gifts and their compassion to address that need.
So people ask me, first of all, gerontology, what the heck is that? I'll just tell you quickly. I tell this to everyone because I'm very, very clear about this. I am not a physician. That is a common misconception about gerontology. We have an identity crisis. Gerontology is actually the non-medical study of aging, which I feel like is the more fun part of aging because it's a non-medical study of aging. So we kind of look at all the different aspects of living as we grow older. I technically started out as a gerontologist when I was 11, is what I tell people, because in my neighborhood growing up in New York, I was a friendly companion where I went to elders' homes and visited with them and spent time with them. And then lo and behold, I went to college and I learned that, oh, there is actually a field of study called gerontology, and this is for me. So I decided to go ahead and do that. So I have a master's degree in gerontology. I've been in the field for over 20 years. And I have worked in nursing homes, I've worked in assisted living community, I've worked out in the community. For the last 8 years, I've had my consulting business. And the focus of my consulting business is working with organizations that support elders and elders with dementia to help them to become better so that they can serve elders in a person-centered way. So I work with nursing homes, assisted living, all those different folks, and I do a lot of education. So that's me.
I'm Michelle Nielsen. I'm coming over here. I'm a physical therapist and have been one for 10 years now. I can't believe I'm that old. But I've been a dancer my whole life. So I started dancing when I was 3, and I studied here locally under Denise Wall. I don't know if you guys have heard of her. And then further, this program is really exciting for me because I have a personal connection with dementia. As my grandparents, I've had them all. I had my great-grandparents, my grandparents, and we all lived here, and I've been really close with them all. Mm-hmm. And I was really close to my grandfather who developed Alzheimer's. So I have a personal connection with the progression. I've seen it from the start. I've seen it progress. I've seen what it does to families and caregivers and the hurt that it brings. And so I'm really excited today, and I hope that I bring to you guys some medical background as to why we're doing things, because I want you to know why I've created it the way I've created it. But I hope that I can just bring some love and light into not only the folks with the dementia, but to the caregivers. I want you guys, and I want not only the caregivers from a professional standpoint, but my at-home caregivers to just have some fun in their day and maybe connect with their loved ones in a different way than they wouldn't be able to do. So I hope that happens today, if not today, when you're working with you guys later. So.
Thank you. I want to just kind of get a sense of who you guys are. So how many of you are professionals that work in the field of aging or healthcare? Great. We're going to talk about movement and dance. So that's on the agenda, right? But I think we also need to take a step back and talk about this a little bit more broadly, too. I think if we're talking about dance and movement for people with dementia, we also have to take a step back and really think about the experience of living with dementia, and what that means to a person, because we have to understand where they're coming from in order to connect with them. And I think that's what we're talking about. Dance is such a powerful way of connecting with somebody with dementia, not just because it is a social opportunity, but because it's a language as well. It's a way of us communicating to them, and it's about creating this space with people with dementia where they can communicate with us in a safe way. So we're actually going to talk a little bit about communication before we go on, and Michelle talks about some of more of the practical aspects of dance and movement. And I think that's a good foundation for this. I think it's a good foundation that we, coming into this, thinking about that, of how do we connect with people with dementia? What are the tools that we might need? You know, how do we engage people? How do we connect with people through our relationship with them? So that's what we're going to do just for a little bit in this time together. We're going to talk just for a few moments then about this idea of living with dementia and what this means and why this is important, and some communication ideas that hopefully you can take with you both today and beyond today. I love this picture for many reasons, but I love what they're saying here too. And this is such a central part to what we call person-centered care. This idea that each person with dementia, each one of you in this room is an individual that has their own history, their own preferences, their own life story, that there's everything about each one of us that makes us so unique. This is not different when someone has dementia, that each person with dementia is an entirely unique individual. And the reason why this is important when we're talking about things like dance is because not everyone is going to respond and interact in the same way. Just like all of you, if we had a dance floor right now, I bet I would see a lot of different moves going on. And I maybe would see some people not participating at all, right? Because maybe that's not your thing. Maybe you just tap your foot. That's okay. You know, each person with dementia is totally different, and we have to keep that in mind. That it has to be the basis for however we connect with someone with dementia. Another quote that I love is, this quote is from Dr. Richard Taylor. Dr. Taylor was a psychologist who developed dementia and lived with it for a number of years until he passed last year, not actually from Alzheimer's disease, but from cancer. One of the things that he taught us is that as a person with dementia, his biggest fear and concern was that people did not see him as whole anymore. They did not see him as a person. And that when I talk to people with dementia, and I've talked to hundreds of people with dementia, they say the same thing to me. They feel like they're treated as if they're not there. What amazing tool we have with dance and movement to help people feel like that we are connected to them, that they are part of this world with us right now in this moment, right? I mean, it's an amazing tool that we can use. And I think that this is what it does for people, is it connects them to us. And it helps us to tell them that, yes, you are still here. We know you're still here. Another thing to keep in mind. So these are domains of well-being that were developed by an organization called the Eden Alternative and Dr. Al Power. And what their philosophy in a nutshell is that we have these basic human needs that create well-being for each one of us. This does not change whether you are 90, whether you're 2, whether you have dementia, whether you don't have dementia. We all have these basic human needs. So when you look at that, it's kind of like a hierarchy of needs. And I think the question that we can ask ourselves today, and maybe this will be in the back of your mind, is how does dance and movement, how does it impact these needs? How does it impact someone's identity? If someone was a dancer before, if dancing was important to them, it fills that need. Connectedness, that intimate relationship you have with someone when you're dancing. I mean, have any of you ever danced with someone that you didn't know? You know, and it was this connection. You know, I went to this line dancing thing once, and someone just walked up to me and started dancing. And we had this strange connection, right? I mean, it's an amazing connectedness that we have. Security, it can be a security for people to do something that's familiar. Autonomy, to be in charge of something, to maybe even be leading something is a powerful feeling for people with dementia. Meaning, something that has purpose. Growth, something new. People with dementia still learn and grow. We all do. That's life. Joy, self-explanatory, right? We can get so much joy from dance, from movement. This is another quote that I love from a man called Michael Verdi. And the reason why I love this quote is because he talks about when we're interacting with someone with dementia. This is such an important lesson. To always be telling yourselves in the back of our head, this is not about me. You know, this is about seeking connection with this person on their terms. And sometimes it's not even terms I understand, right? but we have to put our own egos aside sometimes and really, really be there present with someone. What a powerful message. And I love what he says in the second part of this quote. He says how he is going to love that person in their image instead of me trying to recreate that person, right? It's being with that person where they are and knowing where they are and loving them in that moment for who they are. That's a really powerful tool in communication, probably applicable to any situation when you're interacting with someone, but especially people with dementia. Another thing to just keep in mind, and I think this is useful, especially when we're talking about dancing and movement and interacting with people, is we have to be with people where they are, you know? So we can't tell people to go where we are because that doesn't really help a person with dementia. You know, we have to understand where they are and then we have to meet them there. So for many of you that work with people with dementia, you know this. You know that you have to go there. You have to understand, right, where they're coming from. Even if it's a place that you're not really sure, even if it's 50 years ago, that we have to meet people there. And this is extremely important because it helps us to see their perspective and where they're coming from. So when we're talking about communication, connecting with people, it's important that we do understand where they are because people with dementia have communication changes. That's where they are. They're in a situation where they don't have the tools to be able to communicate like you and I might be able to. So they have all these challenges, these word-finding challenges. Maybe they don't know how to express something. Maybe the way they're expressing it is through the way that they're acting. And so we have to understand that because the person is in this place. That's not going to change. You know, we have to change. And so dance, again, is an amazing way that we can connect with someone and have this interpersonal relationship that doesn't entirely rely on verbal interaction. There doesn't have to be any words, actually. So a couple of tips to kind of think about. You know, many of these you may know, but always bears repeating. You know, sometimes you have to wipe the cobwebs off the brain, right, and remember all these things that we all know. A couple things I'll highlight here is using someone's preferred name when they have dementia is, I know it's considered polite to always call someone Mr. or Mrs., but I'll tell you sometimes why that might not be the most appropriate thing is, so for example, say Sonya Barsness is 85 and she has dementia. And you say, "Hi, Mrs. Barsness, how are you today?" And I go, I wonder who she's talking to. Because in my mind, if I'm 23, I was not Sonya Barsness at that time. I was Sonya Sturbins. Not that people can say that well, but I was in a different place. So the person may not identify with that name that you're calling them. So it's just like a simple thing to connect with someone, right? Is to use the name that actually resonates with them. Some other kind of, basic communication things, the idea of really connecting with someone, eye contact, being at their level, their same physical level. If anyone has ever had the experience of someone talking over you, maybe you've had it in a doctor's office, it immediately connotes that you have power over that person. Immediately you feel like that person is above you, literally. And so, whenever possible, when we're speaking with people, to be at their level so that we can truly connect with them. Speaking slowly, speaking in simple sentences, not really, for people like myself that are from New York, this is difficult because I tend to use a lot of words, so I really have to scale it back. And so just as much as possible to be simple. And I think the nonverbal part of this is extremely important because we're talking about paying attention to people's gestures and what they're telling us, as Donna had said in her video. A few things here to highlight is always asking people how you can help. Tell people what you're doing when you're interacting with them. Give them some guidance so that it's not coming out of left field for them. Laughing together. Is laughing not the best way to connect with somebody? No matter what, we can all laugh together, right? Avoiding negative words. We say a lot of no's to people with dementia in different ways. How can we say things in ways that are more positive? Avoiding arguing with people with dementia. I heard once someone had said that there was some researcher said he would give $1 million to the first person that won an argument with someone with dementia. It's been unclaimed because you can't. Because if someone thinks this is their reality and you're telling them it's not, you're wrong. So it's best not to do that. couple of helpful go-to responses. Like I had said, I think that we inadvertently, many times, say no to people with dementia in many ways. We say, no, you can't go there. No, that's not for you. No, don't do there. That's not the place you're supposed to be. We say this a lot with good intention. We're trying to keep people safe. But you can also imagine the impact of that after a while, of being told all the time what you can't do. You know, how good does it feel to say yes? To have someone say yes to you. You know, I want to go home. Yes, I understand. Let's have a cup of tea. You know, have you seen my mother? No, but tell me about your mother. You know, how can we say things in different ways that people can really connect with us, and that we're not in this position where we feel like we have to kind of shut people down, but really facilitate them opening up with us? I think it's a really different way of looking at it. One of my favorite responses is, I don't know. It's okay to tell that to people sometimes. I don't know, lots of times. People say to me all the time, do you know how I can get out of this place? I go to a lot of nursing homes, and they say, do you know how I can get out of this place? And I say, no, I don't know, because honestly, sometimes I have no idea. And that's okay. But all of these tips are going to help us in any interaction, but particularly if we're doing something as intimate as dance and movement with somebody. So I wanted to kind of bring these up because I thought that they would be helpful as we're looking for it. So just a couple of things as I turn this over to Michelle is a couple of ideas to think about what it means to really be with someone with dementia.
As healthcare providers, a lot of us are scientists first, so we want, you know, at least for me, I need to know why, how, what's the point of this, how does this make any effect on this thing or that. I need to have some proof and evidence to what I'm doing. So this program actually gave me a unique opportunity to really take that all in, use the evidence base, the research, and then create a program from that. But also, I work in home health right now. I work at multiple assisted living facilities. I mean, what is hammered into all of us? Fall risk, right? Primary concern of everyone is fall risk. And with good reason. So here's some facts for you. Falls account for 70% of accidental deaths in persons 75 years of age or older. 1 out of 3 persons per year will fall that are 65 years of age or older. 2.5 million of those people are treated in the ER annually. And over 700,000 patients per year are hospitalized, secondary to falling, and then most oftentimes due to a brain injury, right, or a hip fracture. They're the most common cause of traumatic brain injury, and the costs for these falls are at $34 billion a year. There are multiple reasons for these people falling, and they are in 2 basic categories, intrinsic and extrinsic. Intrinsic is physiologic reasons, age, medications, what's going on internally. And the extrinsic factors are what's going on externally, whether it be whatever environment they're living in. So these that I have listed here are all your major risk factors for falling. Lower body muscular weakness, gait and balance difficulties. Oh, that's a little bit. Difficulty rising from a chair, vertigo or dizziness, medications. Look at this. Cognitive deficits and confusion is a primary risk factor for falling, right there. Postural hypotension, which is, orthostatic hypertension when you go from like a lying down position to a seated or standing position, your blood pressure drops out, you at a high risk for falling. Any alcohol, a new acute illness, any type of central nervous system disorder, and then finally your home hazards, your throw rugs, your uneven steps and handrails. Now, as a therapist, if I get a call to any other elderly patient, say with no cognitive deficits, and the order is gait and balance difficulties and lower body weakness, what do you think I'm going to do? What would keep them from falling most? What do you think I'm going to bring with me? A walker, great. I'm gonna say a walker, a rollator, a cane. I'm gonna assess that person and see what assistive device would work best with them, right? and I'm going to give them that cane, I'm going to teach them how to use it, and they're going to be off, and maybe their independence increases due to that, right? What about my dementia folks? Do you think that that's appropriate? Do you think I can just walk in and teach them how to use a walker? It's not. I've tried it. It doesn't work. You can't. So I really want you to look at this list and think, what can I do? How can I improve their fall risk? How can I decrease their fall risk, I should say? What's on the list that I can change? Well, I can look at their medications. And not that you need to memorize these medications by any means, but I did want you to have kind of a list of some medications that can cause dizziness or increased risk of falling. And I just want to point out antihypertensives. I'm going to go with about 95% of the patients I see are on blood pressure medication, right? And then on top of that, they went to Dr. Smith today. They went to Dr. Johnson yesterday. They went to Dr. Jack the other day. Nobody's talking to each other, right? Okay, and then I have this med list that's 300 medications long I got to type in, and now they're on 3 different blood pressure medications. What's that going to do? Well, they're going to fall. Their blood pressure is going to be so low it's going to tank. So we need to really be looking. We know our people better than the doctor knows our people. We're with them every day, right? So look at this. If the smallest thing, keep the inserts to the medications, because they might not be on this list, but you could say, dang, my mom just got put on this new medication, and, she's acting funny. She can't get up out of the chair all of a sudden. She can't walk all of a sudden. Let me go to the insert and see what the side effects are, right? So then, what are we going to do to change this? We got to go to their primary care doc. Let's take all this med list to their doctors and say, hey, could mom be having this problem because she's on this diuretic and this blood pressure medicine and this antidepressant, all these 3 together, could that be causing a ask them. That's what you have to be their advocate, right? Next, you can have their eyes checked. Vision problems, a lot of these guys are looking out of glasses that they can't see out of, right? Maybe they had cataract surgery and now they don't even need the glasses, so the glasses are a worse thing than anything, but the one thing you can do is provide adequate light. A lot of these guys, in the dark, they can't see at all. So let's change their lighting. Make their home safer. Get an evaluation for these folks. Get PT and OT in there. Should I have grab bars here? Should we have a ramp? Let's remove. I walk in these houses, and I can barely walk. I'm doing this because there's stuff everywhere, right? A lot of people are really resistant to taking up throw rugs for whatever reason that is, right? Throw rugs are such a hazard. They slip all around. They can't get up out of the chair. Get them out. Tell them why it can't happen. And then finally, why we're here, let's get them involved in some type of strength and balance exercise program, right? And physical activity, it's going to have multiple benefits for these folks. It can improve blood pressure. Maybe get them off a couple of those medications, right? We can positively affect heart disease. We can increase their independence with activities of daily living, slow their mental decline, and provide social interaction on top of everything, right? And so you say, how do we do that? Well, going back to the little video you watched and kind of going off what Sonya said, we need to encourage activity in whatever respect. Will this program today go over with all these guys? I don't know. I don't know them. And it could today and it could not tomorrow. We just need to promote them being as active as possible, because things like just rising up out of a chair requires muscular strength, power, endurance, flexibility, right? And an element of balance. We want to modify these activities to fit their individual needs, right? So maybe your patient or loved one, they don't like to dance. So don't do that. Maybe they like to exercise, right? So tap into what they love. But it has been shown that dance is something that these folks really like, and especially these guys. And when I was developing this program, I really thought back to my grandparents, and I thought about the music that they used to dance to me with, and they used to get me up dancing and taught me how to jitterbug. And I was trying to think of what would they like, not what I would like, but what would they think is fun in their type of dancing. They did this social dancing that we don't do anymore. So I'm hoping that comes together, but I was really trying to take that into account and fit them individually. Also, if your person is in a wheelchair, they're not going to get up, right? So let them do everything they can in the chair. Have them dance in the chair, whatever appropriate for them. If they're using a walker to ambulate, use the everything we do. Hold on to the walker. Don't take it away from them, right? Let's just meet them where they are, just like Sonya said. And then the activities should be done if we're thinking about fall prevention, and this is good for our folks in the ALFs and everything. Maybe we can get some objective numbers and decrease our falls. And is the activities should be done that develop power, balance, strength, coordination, reflexes, and body awareness. Any evidence-based fall prevention program must include strength and balance training, review of these meds, and an assessment of the environment. Now, obviously, if you're in the ALF, your environment's pretty safe, but if you're at home, you definitely want to assess and change any adverse environment. The program must include exercises that strengthen the leg and ankle musculature, challenge balance, and involve specificity of training, right? So I say that include exercises in standing. Now, obviously, if your folks are wheelchair bound or they can't get up, that doesn't work. But any exercise we do, all the research points it has to be sport specific or activity specific, right? So when I'm treating dancers in the clinic, my professional dancers, I do not have them kick a soccer ball, because why would I have them kick a soccer ball? What is that going to do for them? I have them do plies, developés. We're dance exercises, right? Same here. If I exercise from here to here for my bicep, I will only strengthen from here to here. I will not strengthen from here to here, right? So we want to do we want to train what we're trying to improve. So if we get these guys up and standing and to challenge their balance, especially their dynamic balance, we're going to have a positive result. And then obviously tailor it to these individuals. And then, like you saw before, the dementia folks really seem to respond to music and dance using simple steps and props. For an effective program, it should be performed regularly, 2 to 3 times a week preferably. So I've tried to design a program that could be done that way with it really easily. It doesn't take a lot of time, effort, or strength. And then be hard enough to pose a challenge. So how can we do this? Through dance. Well, according to the American Dance Therapy Association, dance movement therapy uniquely addresses the needs of adults with Alzheimer's disease and dementia by relying on movement and other nonverbal communication as the primary means of communication. This manner de-emphasizes the verbal communication and emphasizes the nonverbal communication and decreases their emphasis on their cognitive deficits and allows them to participate from an area of ability as opposed to disability. The rhythm and the repetitive movements often spark memories of their past, and that can really help these individuals become more alert and organized.
Is that because of muscle memory? That it sparks memories? Is that?
I don't think so. I think it's like, with the dementia folks, they, I know with my grandpa, like he couldn't remember yesterday, but he could remember World War II. Does that make sense? So, and like she was saying, he wouldn't, if it was my grandma, she wouldn't know her married name, she would know her maiden name, right? So these guys, this music might spark a memory for them when they were younger.
Yeah, I think absolutely. It's like from a reminiscence, and then I know that just any type of physical movement, because it increases blood flow to your brain, creates kind of an acuity, in terms of a clarity in your brain. So that's one of the reasons why they say exercise and programs like this are so helpful, is because it actually helps people mentally and cognitively.
Yeah, it's really interesting. And then, you have the added bonus of all these psychosocial benefits, right? They have increased self-awareness, the social interaction that they get that they normally wouldn't have gotten. You can help decrease symptoms of depression and anxiety, channel this agitation and aggression, which is so common with these folks. Provide opportunities for safe expression, for them to do whatever they want to do. To maintain memory and cognitive function and strengthen neurological pathways. Now, this is really cool. I found this study. It's a 21-year study of senior citizens 75 years of age and older, led by the Albert Einstein College of Medicine in New York City, funded by the National Institute on Aging and published in the New England Journal of Medicine. And it was done to see if any physical or cognitive recreational activities influence mental acuity. They discovered a significant benefit to some activities while others had absolutely none. One of the surprises of the study was that almost none of the physical activities appeared to offer any protection against dementia, with one exception. Dance frequently showed the greatest risk reduction of any activity, both cognitive and physical, at a 76% decreased risk. The thing that came the closest to that was crossword puzzles 4 days a week at 45% decreased risk. Reading was a 35% decrease. Bicycling, swimming, and playing golf, no change. None, 0%. So 76% decreased risk. And so they asked the question, why would dance cause a significant cognitive benefit? And it's because our brain constantly rewires its neural pathways as it's needed, and if it doesn't need to do it, then it won't. Now with dementia, we're constantly progressively losing neural pathways, and if we don't challenge these folks, they'll never create new ones, right? Well, dance has the ability to integrate several brain functions at once, increasing neural communication. And so they found that the dance that does this the best is the one that requires split-second decision-making as opposed to route memory, which causes new neural pathways to develop. Now, what kind of dance do you think might do this? Anyone? They're dancing. They're social dance. The lead follow, right? So from all this information, what does it all mean? I've really taken everything into account. What my grandparents would like, what from the music, how would this be helpful? This program, I feel like I've uniquely designed in the sense that you could use it as one program or just pull pieces out, right? So I have a chair dance for folks that can't get up. We're gonna do a rumba line dance. I don't know how that's gonna go. But I'm going to share a little bit with you guys before we even go in there, because it would be fun for the caregivers. It might be fun for them. Maybe they don't do it as a line dance, though. Maybe they do it as a lead follow dance, and they get it because that's the kind of dancing that they used to do. Tried to tap into this study and try to incorporate that as part of my thing. I want to strengthen the lower extremities. I want to affect coordination. I want to affect balance. I want to affect reflexes. So I feel like I've incorporated all these principles, and I hope it's not apparent, is what I'm getting at. I hope it's just super fun. And if it's not today, maybe it is tomorrow. I don't know, but I do know that I want to just show you when we do this little rumba line dance, I don't want to say much. We were talking about communication, and from what I've learned from the speech therapists I've worked with, is that you don't say much. You say very, very small amounts, right? Because they'll lose you as you go. But if they could just mirror me, that would be great. We're going to do a simple box step, right? If I see that this is all they can do, that's all we'll do the whole time, right? And just get them to go. It also involves a little cross step. Maybe they do it. Maybe they don't, right? But if, for you guys at home, come. So when I'm guarding people, when I do dynamic balance exercises, I usually guard them like this because it gives me a lot of control. Maybe the guys want to do this. They probably do. You know what I mean? But whatever. So I try to keep the guys about this distance, but sometimes it doesn't work. Okay, so what you'll do with them is step this way. Just try to follow me back. Nope, you come with me.
Oh.
Yep. Now this way. This way, now that way. Yep. This way, this way, this way. It's left, right, left, right, left, right, left, right, left. So easy, right, left, right. But how fun would this be to look someone in the eye, engage them, not talk to them, and just go with it, right? Now, if they're good, you cross it, and then you go this way, and you cross it. Right? Turns. But the actual whole line dance, all it is we do a box step. We do it 3 times. and then we're going to cross over. 1, 2, 3, step to the side. Do it again, same thing. So it's very repetitive. It's the same activity the whole time. We're going to do it in there. I just don't want to say to them, right, left, right, left, right, left, right, left, right, turn around, bend down, pick up a balloon. You know, I just don't want to confuse them, but what I want to do is tap in to what they used to do, hopefully. That's their kind of dancing. It's not our kind of dancing, right? And then also, just so you guys know, if the older folks, I mean, some of you guys will know them better than some of you will. If they need to sit in the chair the whole time, awesome. If they want to play with the scarf the whole time, great. If they want to hit a balloon around, that's great too. But I'm trying to incorporate all of the things that I've talked about today into a program that is evidence-based that you could use at your facility, or take out and pick up your favorite song for your folks and steal my little dance and put it to the song that they like the best, right? Okay, good.
So when I was putting this together, I was thinking about this in a couple of different perspectives. I was thinking about it of not just inspiring people with dementia to participate, but how are you going to inspire maybe the rest of your team or your family members or whomever that you're wanting to do these exercises, you know, and activities. And so I thought about a couple of like devil's advocate kinds of situations and what people would kind of say. So a couple of things that, you know, to kind of just throw out there is, in my experience, there is an art to invitation, right? So many of you who are in activities, you totally understand this because there's a way that you ask people to engage in something, right? And so people with dementia, for each person, this works differently, right? Because you know them, you have a relationship with them. So you might say, Mary, do you want to dance? And Mary might say, oh yes, that's lovely. You might say, Joe, do you want to dance? And he might go, ugh, right? So we don't know, you know, we have to be prepared to kind of respond to people in different ways and recognize that for each person to kind of understand where they're coming from again, that idea of going where they are. So if we know that Joe, you know, was a big fan of Fred Astaire at some point, that might be something that we can talk about. Do you remember Fred Astaire? Oh my gosh, do you remember the way he danced? You know, and to do it yourself. Like Michelle had said, sometimes it's modeling and just doing it and not asking. You know, sometimes it's just playing the music is the invitation. So think about all those different ways that we can invite people to
participate. Or just
participate.
acting completely goofy. Like,
yeah.
I go into people's rooms and just dance for them. And be like, ah! And they think that's hilarious. And
Yeah.
it starts them in a positive way.
Yeah.
If I just come in and I'm totally crazy.
Yeah.
Whatever, I look at it like this. Whatever my 2.5, 3-year-old would respond to, they usually do too. People like it, just to be goofy and just let go of yourself. Let your wall down, and they'll let their wall down too.
Yeah, I mean, it's so true. It's contagious. I mean, how many of you have been at a wedding and someone says, do you want to dance? And you're like, no. And then you can't help. You're like, all right, well, I guess I will because everyone else is dancing. You know, it happens. So the other thing I hear a lot, especially in professional situations, but I think this could be with family caregivers certainly as well, is I don't have time for this. This sounds lovely, but I don't have time, right? Huge issue and a reality. So a couple of things just from my perspective that are out there is if this is something, if you work in a nursing home, assisted living, adult day, et cetera, and this is what your staff are saying, if you're a leader, if you're in a position that you are supervising, managing people, to really think about how you can make this an expectation. You know, that this is like expectation for your team, that this is what we do. This is actually a part of caring for people, is, you know, meeting them in this place and caring for not just their body, but for their spirit, for their mind. So, you know, as a leader, how are you doing this? And I would add to that too, that you may as a leader say, absolutely, you know, whenever you have time, you know, do something with somebody. But then what might happen to that CNA is that she goes to try and do this and supervisor says to CNA, that's really nice, but you have 5 people that bathe today. So I'm sorry, but that's not gonna happen. So it's a conversation. Anything that we're doing in any type of environment like long-term care, it has to be a conversation with everybody involved. It's hard to kind of just go in and tell people. Like if you guys come back from this workshop and go back to your communities, your long-term care communities, and you tell your staff this is what we're gonna do now, I almost guarantee you it's gonna be mutiny. So it's a conversation, you know, of explaining to people why this is important and this is why this is how it's gonna benefit them as staff as well as the person with dementia. Another One is, so I can identify with this because I am an introvert actually at heart. And so I am not really a big fan of leading activities. So if someone were to say to me, oh, guess what, Sonya, you're going to be leading this dance, with this group, I would probably run. That's not my thing. But every person that's participating in this doesn't have to be leading it. Everyone can have a role. You could be just a part of it. You could be on the side. You could be encouraging people. You could be humming. You could be acting silly. There's all different ways to be a part of this. And that's the same thing for people with dementia. It's that whole idea. You might just have someone in the corner tapping their foot, and that's okay. They're a part of it. Or maybe they want to watch. They want to be voyeurs. They want to see what's going on, and that brings them joy. That's all okay. So that's a way of participating. Anything else in the last couple of minutes we have that you have tried, to inspire participation in anything like this? Any things you found successful? Yes?
I've tried actually playing a musical instrument, different tempos, playing the accordion, and if I see they're getting a little fatigued or they're having trouble, I can slow down the music. Years ago they used a variable phonograph, but they see me having fun and I see them having fun. There are a lot of different layers there.
Absolutely. I think that's a great point.
Yeah.
Thank you. Anyone else? All right. Well, I'm going to tell you what we're going to do is we're going to be moving to another area, and we're going to be doing actually what we're talking about. A couple of things that we wanted to mention is we are going to ask each one of you to find a partner, an elder, that you're going to partner with, and sort of be that person's guide, their encourager, be with them to go through the various movements that Michelle is going to guide us through. So don't worry, she's going to guide.
Well, I'm going to guide you through every single one except for one. At the very end, I want you guys to kind of take what we've done and just dance with them. You don't have to have any dance background. Either let them do what they want to do, or have them try to mirror you, or whatever you think is fun. Hopefully it'll be super. You could go grab some of the props that I have in the other room. However you want to do it, but I think it will be a really fun activity. Whether it's just that we're having a big dance party, or you're actually taking some of the advice that I've given today, or that we've given today.
We're together, weather-wise, it's such a lovely day.
I think the older folks really liked it. They lit up, they engaged, and they really loved it from what they told us, and they actually verbalized that, so that was really exciting.
Some people that I have loved very much are not here anymore, and we always had such a good time together, and so
It brings back those happy memories.
It brings back all my happy memories. That's right.
Are you guys ready? So, tap your toes. Yeah. Heel. Move your leg out. In. Out.
It was amazing just to see, people with dementia that I think in the beginning they were very reticent about what was happening, and it was a little bit boisterous, but they almost automatically became engaged when they heard music and they saw all of us moving, and I think it speaks to us modeling and our body language, and if we're happy and we're projecting joy, that the people that we're caring for are going to also have that.
When marimba rhythms start to play, dance with me, make me sway.
Yeah.
Like a lazy ocean hugs the shore, hold me close, sway me more. Like a flower bending.
I'm really thankful for today. I'm really thankful that TAO and BALIC has given me this opportunity to develop a program that I otherwise wouldn't have developed. And it's taken my passion for physical therapy and my passion for dance and brought those two together into a really neat program. So I'm very grateful.
Here we go.
It might seem crazy what I'm about to say.
All right, we're just gonna clap. You ready?
Sunshine, she's here. You can take a break.
You guys remember the jerk?
I'm a hot air balloon that could go to space.
personally, and what I've observed professionally as a gerontologist, is that dance is such a powerful tool in how we can connect with each other. You know, we find it in our personal lives that second that you have that opportunity to dance with somebody, you have this new relationship with them. And I think with people with dementia, it's the same thing, because when we do what we call person-centered care, it's really based on that relationship we're having with somebody, and this is a way of building relationship.
Shelter of someone's arms, and there you were. Needed someone to understand my ups and downs, and
all right, let's try to do a little kicking. Here we go. Step.
With sweet love and devotion, touching my emotions. I wanna stop and thank you, baby. I just wanna stop and thank you, baby. Oh yeah, how sweet it is to be loved by you.
Today we brought together a gerontologist and a physical therapist who's also a dancer, and we've had them work together to create a brand new workshop module to train caregivers on how to use dance for functional, emotional, spiritual, and wellness improvements in the people in their care. And it's a wonderful marriage, I think, and a really important reason why TAO exists.
You brighten up for me all of my days with a love so sweet in so many ways. I wanna stop and thank you, baby. I just wanna stop and thank you, baby. Oh, oh, how sweet it is to be loved by you.
So this last one's just to cool us down. Just to get a little flexibility going. Yeah? Make everybody yawn now. Can you guys stretch over to the side?
The workshop today here at Bay Lake was wonderful. Participants gave the workshop high grades. We saw a lot of joy in the room of people dancing together. But you know, this kind of thing happens week in and week out through programs that Tidewater Arts Outreach presents in the community. If we had more dollars for marketing, we'd shout it from the mountaintops, and we'd make sure that every story was heralded. Unfortunately, we can't thank all of the artists who are doing all of these programs. We can't shine a light on all the people who are participating and the hardworking staff who give so much of themselves for these people in their care. So I just want to take this opportunity to say that this magic can happen every day in many places for thousands of people in our community through the arts.
Can you look